Hello, and welcome back to Health Insights MD. I'm glad you're here because when a kidney number changes, you deserve clear answers, not more confusion or fear. You just checked your lab results online, and there it is. Your eGFR is lower than it was a year ago. Your first thought probably wasn't, "Oh, interesting. I wonder what that means." It was probably closer to, "Oh no, is something wrong with my kidneys?" And now, you're doing what people do. You're Googling, you're worrying. And maybe you're wondering if you should call your doctor right now or if you're overreacting. The truth is, a single eGFR drop doesn't automatically mean you're heading toward kidney failure. But it also shouldn't be ignored. And before you walk into your next doctor's appointment, or if you haven't scheduled one yet, there are 7 specific things you need to do, 7 questions you need to ask, and 1 critical appointment checklist you need in front of you. That's what we're covering today. Stick around. If you've ever gotten unexpected lab results, you know that feeling. The moment your eyes land on a number that's changed, everything shifts. Your brain instantly starts running scenarios, and suddenly you're wondering if you should feel scared, or if you're being dramatic. That's not drama, that's your body doing what it's supposed to do when you get incomplete information. It's a snapshot of how well your kidneys are filtering waste, and it's one of the few health markers you can actually track over time. But here's the thing that most people never hear. A single number by itself tells you almost nothing. It's the pattern that matters. It's the context that matters. And before you assume the worst, you need information. The reason I'm making this video is because I've seen too many people walk into a doctor's appointment armed with worry and a Google search history, but not with a plan. You'll also understand why your eGFR might have dropped, and whether it's worth panicking about or just worth paying attention to. Let's start. Your old lab results. And I mean all of them, going back as far as you can find them, ideally at least 2 to 3 years. Here's why. eGFR naturally fluctuates a little bit. It's not a rock-solid, unchanging number. It moves based on hydration, activity level, salt intake, and dozens of other temporary factors. If your eGFR has been bouncing between 58 and 68 for the last 3 years, and today it happens to be 58, that's noise. Not necessarily a crisis. But here's where it gets interesting. Many people don't actually have access to their old results because they've changed doctors, or their results are scattered across different systems, or they've simply never written them down. If that's you, here's what you do right now. Log into your hospital's patient portal, call your doctor's office, or request records from your previous providers. Yes, it's a bit of a hassle, but this step alone can completely change how your doctor interprets what's happening. When your doctor sees a 6-point drop in 6 months, they're thinking one thing. When they see that your eGFR has been stable for 3 years, then dropped 6 points, they're thinking something different. One looks like a sudden change that needs investigation. The other might be random fluctuation. The context is everything. While you're gathering these results, also note the dates they were taken and the lab that performed the test. This matters because different labs sometimes use slightly different formulas or equipment, which can cause small variations. Not huge differences, but enough that you want to know if your last 3 results came from Lab A and your newest came from Lab B. Write all of this down on a simple spreadsheet or piece of paper. 3 columns, date, eGFR number, lab name. That's your starting point. Almost nobody realizes this. But the first conversation with your doctor should start with the data you've gathered, not with panic. You're going to walk in and say, "I've been looking at my eGFR over the last 3 years, and here's the pattern I've noticed." That instantly frames you as an informed, thoughtful patient, not as someone who saw one number online and freaked out. It also helps your doctor see the full picture instead of just reacting to the most recent number. This is the step where most people have a breakthrough moment. Because what we're looking for here is very, very common. Certain medications can affect your eGFR number, not because they're damaging your kidneys, but because they change how your kidneys filter, and that shows up in the calculation. The biggest culprits are NSAIDs like ibuprofen and naproxen. If you've been taking these regularly for arthritis, back pain, or headaches, that's a conversation you need to have. It doesn't mean you're on the wrong medication, it just means you need to know about the connection. ACE inhibitors and ARBs are another category worth mentioning because these are blood pressure medications that actually protect your kidneys in the long run. But they can cause a temporary dip in eGFR when you first start taking them, or if your dose is adjusted. This is actually a good thing. It means the medication is working. But if you're not expecting it, you might see that dip and panic. Your doctor needs to know if you've started or changed doses on any blood pressure medication recently. Here's where it gets interesting. Your blood pressure itself is deeply connected to your kidney function. High blood pressure damages your kidneys over time. It's one of the top 2 causes of kidney disease, right alongside diabetes. So the second thing you're going to do is check your blood pressure. If you don't have a home blood pressure monitor, now is the time to get one. Take your blood pressure 3 times, a few minutes apart, and write down the average. Your target is roughly 130/80 or lower. This is the range recommended for people with any kidney concerns. Pull up a list of every single medication and supplement you're currently taking, along with the dose and how often you take it. Include over-the-counter stuff, herbal supplements, everything. This is not paranoia, this is due diligence. Some supplements can also affect kidney function or interact with medications. Bring this list to your appointment. Don't rely on memory or the list your doctor already has, because lists get outdated. Your current list is your baseline. Now here's what most people miss of, or interact with medications. Bring this list to your appointment. Don't rely on memory or the list your doctor already has, because lists get outdated. Your current list is your baseline. And if your eGFR dropped shortly after you started a new medication or increased a dose, that timing might explain everything. If your eGFR has been stable for 2 years, and then you started taking ibuprofen regularly for knee pain 3 months ago, and now your eGFR dropped, your doctor needs to know that sequence. That information might shift the entire conversation. Dehydration is one of the most overlooked reasons for a temporary eGFR drop, and it's probably also one of the easiest things to fix. Your kidneys need adequate fluid to function properly. When you're dehydrated, everything is more concentrated, and kidney function appears to dip. But hydration-related drops are usually reversible. Get properly hydrated, and your eGFR often bounces back. So, be honest with yourself. Have you been drinking enough water? I know, that sounds like generic health advice. But this isn't generic advice. This is specifically about your kidney function. You need enough fluid so that your urine is pale yellow or clear. Dark urine means you're likely dehydrated. If you've been traveling, or it's been hot, or you've been focusing on other things and neglecting to drink regularly, that's relevant information to share with your doctor. One of the simplest first steps might literally be drink more water and then retest in 4 to 6 weeks. Salt intake is the other factor worth examining. High sodium intake raises blood pressure and makes your kidneys work harder. If you've made any significant changes to your diet recently, maybe you've been eating more processed foods, or you've added canned soups, or takeout has been more frequent, that can affect your kidneys. This isn't about going on a strict low-sodium diet, but it is worth asking yourself if you've drifted toward higher salt foods without realizing it. Here's something else worth looking back on. Has anything changed in your life in the last few months? Major stress, if you've drifted toward higher salt foods without realizing it. Infections can cause temporary elevations in creatinine, which is the marker used to calculate your eGFR. So a recent kidney or urinary tract infection might explain a temporary dip. Also, intense or new exercise can cause a temporary rise in creatinine, which might show as a lower eGFR for a few weeks until your body adapts. If you've suddenly started training for something or ramped up your workouts, that might be a factor. And here's the detail most people miss: the time of day your blood was drawn and when you last ate. It's a small effect, but it's worth noting, especially if your drop is in that 2 to 5 point range. Before your appointment, you need to know exactly what questions to ask and what tests to request if your doctor hasn't already ordered them. This is where you move from reaction to strategy. First, the tests. If your doctor ordered only one eGFR number and nothing else, that's incomplete information. You need a panel that includes creatinine, the waste product that eGFR is based on, your blood urea nitrogen, which is another marker of kidney function, your electrolytes, your sodium, potassium, and phosphorus levels, and your urinalysis. The urinalysis is incredibly important because it tells you whether there's protein in your urine, which is a sign of kidney stress. A protein in urine, combined with a dropping eGFR, paints a very different picture than a dropping eGFR with no protein in the urine. If your eGFR is below 60, or if you have diabetes or high blood pressure, you should also have your urine albumin to creatinine ratio measured. This is more specific than a standard urinalysis and catches early kidney disease screening, or it's a standard part of kidney disease screening. This is an alternative way to calculate kidney function, and it's sometimes more accurate than creatinine-based eGFR, especially in older adults or people with certain body compositions. If you got a 3-point drop in creatinine-based eGFR, but your cystatin C is stable, that tells you something important. The drop might be less significant than it appears. Now the questions. When you sit down with your doctor, here's what you ask. Is this drop something we need to investigate further, or is this within normal variation for me? Fourth, what is my eGFR trend over the last few years, and does this look like a pattern or a blip? And fifth, what lifestyle changes would have the most impact on my kidney function right now? There's one more question that almost everyone should ask, but almost nobody does. How are my other markers of kidney health? My urinalysis, my blood pressure, my albumin to creatinine ratio, are all of those stable? Because if your eGFR is down 6 points but everything else is stable, you're in a very different situation than if your eGFR is down 6 points. And you also have new proteinuria. Your doctor is looking at all of these things in context, and you need to understand that full context. This is the section that transforms information into action. You're going to write down a checklist before you go in, and you're going to bring it with you on paper or on your phone, not to grill your doctor, but to make sure you have a coherent conversation and you remember everything afterward. On your checklist, write 1. A list of all your current medications and doses with the dates they were started or changed. 2. Your recent eGFR results with dates and labs. 3. Your blood pressure readings from the last week. 4. A note about any recent infections, major stress, or changes in diet or exercise. 5. Your 3 most important questions for your doctor. And 6. Space to write down what your doctor recommends, including any medication changes, lifestyle modifications, new tests to be done, and the date of your next retest. That last part is critical. You want to know exactly when you're going to retest your eGFR. And if your doctor thinks there's a progressive pattern, you might retest in 3 months. You want this date written down. You also want to know what your doctor's plan is. Are you going to manage this with lifestyle changes and monitoring? Are you going to add a medication? Are you going to see a nephrologist for further evaluation? All of that should be clear before you leave. Here's what most people don't do but absolutely should. Ask your doctor for a copy of your full lab results, not just the eGFR number. Ask for the creatinine, the urine albumin, all of it. Get it on paper or ask them to send it to your patient portal. You're going to use this to track your numbers over the coming months, and you're not going to rely on memory or your doctor to summarize it for you. After your appointment, your job is to commit to whatever plan you and your doctor have agreed on. If it's a medication change, take it as directed. If it's lifestyle modifications, implement them. If it's a retest date, put it on your calendar right now. Don't wait until a week before to remember it. And here's the thing, start tracking your own numbers. Get a blood pressure monitor and take readings weekly. Keep a simple log. If your doctor recommended dietary changes, actually make them. It's easy to say you're going to drink more water and reduce sodium, and it's another thing to do it. You've done the hard work of gathering information and asking the right questions. Don't sabotage yourself now by ignoring the plan. One final thing, if your doctor recommends seeing a nephrologist, see a nephrologist. A nephrologist is a kidney specialist, and if there's any question about whether this is a serious trend or something to monitor closely, that specialist's perspective is invaluable. It's not catastrophic thinking to see a specialist. It's informed medicine. And if you do see a specialist, let me bring this back to the beginning. You saw your eGFR drop, and you felt that little spike of worry. Your health matters, but worry without information just stays worry. What you've done today is gathered information. You've got a framework for understanding your numbers in context. You know what questions to ask and what tests to request. You've got a checklist so you don't forget anything important in your appointment. Most importantly, you've moved from panic to agency. You're not sitting around wondering what your eGFR means. You're actually doing something about it. That's what this is about. If this video helped you feel more confident about your next appointment, or if any of these steps clarified something that was confusing, I'd love to hear from you in the comments. Tell me what surprised you the most, or what question you're planning to ask your doctor. And if you have other people in your life who've mentioned eGFR or kidney concerns, share this with them. A lot of people are in the same boat, feeling the same worry, and they could use this kind of clarity. Thanks for watching. Subscribe for more health content that actually helps you make sense of your numbers. And remember, your eGFR is one number, and one number never tells the whole story.